For women, as you head toward menopause, lack of energy, the infamous hot flushes, loss of libido, hair falling out, anxiety, and other symptoms as well. And they're almost a given, again, as you go past 40 and beyond, perimenopause and into menopause. So when those symptoms and signs arise, we can do a personalized, again, it's personalized saliva testing for the exact hormone levels. And then the hormones can be, which are all plant-derived, even the base that we mix the hormone component into has plant in it, olive oil and folate, which is an extremely important vitamin for general well-being and can get depleted by toxins and aging and things like that. So it's personalized based on a woman's individual hormone profile. And sometimes we see results immediately within a month or so, but more often than not, it has to be tweaked. And it takes a couple of months to get everything back into balance because it's really a kind of exquisite balance, especially among women. Their hormone picture is a little more complicated than men. And we can get really excellent results for women and for men. I think by 3 months we'll know for sure. And sometimes it's much sooner. It's a little bit easier to, balance the ratios. More energy. That's what we hear often is, I feel better, I have more energy, I'm sleeping better. So what we know as far as hormone disruptors, for women, the big hormone disruptor is mental stress, and that ties it, and also lack of sleep. For men, a major hormone disruptor is actually sugar intake. So when we start to correct, the hormone ratios, the balance is restored. People begin to say, I feel better, I feel stronger, I have more energy, I'm sleeping better, I'm less nervous, less anxious. And for women, I'm not getting those hot flashes that keep me up at night and drench me in sweat at no apparent reason during the day. Now, the major primary hormones we're testing for in women, DHEA, progesterone, estrogen, those are the main, and testosterone. Women have a little bit, and that can be, balanced as well. Compounding is the actual mixing of the molecules and the medications or the hormones. They are not medications. They are hormones that are extracted or manufactured from plant sources. So they are, we can say, identical to what the body has. So the compounding technique is putting those all together in the right proportions based on the results of the saliva testing for each individual. And they're mixed together, derived from plants, mixed together in the right proportion for the individual with a compounding base, which again has many plant components in it, primarily olive oil. And then it is put into a package. Usually it's a click type of dispenser, but it can be something else. A cream that's applied topically once a day or twice a day and absorbed through the skin directly into the circulation. So we like it because another reason we like it, besides the fact that it's derived from plants, is the fact that it bypasses the liver, first pass metabolism, and that saves stress on the body. And as time goes on, we can periodically, it can be done with blood. We prefer to do it with saliva. That will give a few months down the road, maybe 3 months, we'll test again and see, well, what kind of response have we gotten? Because as we said before, everybody's metabolism and biology is individual. So some people may need a little bit more of progesterone or a little bit less of testosterone, and we track it going forward. Men complain again of loss of energy, loss of sleep, loss of libido or diminished libido, muscle mass decreasing, and they're a little bit easier to test and to track, so we can test primarily its testosterone level, and that can be easily corrected. Sometimes it can be added with other B vitamins or human growth issues, but primarily it's testosterone. And again, the first thing I hear, or the first report I hear will say, I'm sleeping better, I feel better, I feel more awake, I'm working out and building muscle mass, and libido also. Men tend to be more concerned, I would say, about that than women, and that is corrected as well.